thanks for tuning in. I have with me an amazing med tech, Jose, who's been with us
4 years.
Yes, 2015. So thankful.
Thank you.
And he is really our lead of all the med techs and does audits, training, and kind of really just holds the whole department together. And the reason we're doing this talk today is to discuss how do assisted livings and memory care dispense of medication. How do they assist the resident with taking their pills? And every facility has different policies and procedures. But at Vista Gardens, we really try to have a triple check. And Jose knows what that means. One thing is the state just governs in a way that says under Title 22 in California, you just keep a centrally stored record. However, that wouldn't work here. So we have come up with better policies. We have what Jose's holding is a MAR, a medication record. And that record is initialed every time a pill is given. And he'll have on there AM, PM, special instructions, and all the state all the state regulations that pertain to that medication dose. However, he also will have a bubble pack that will match the MAR. So when he's passing, right, Jose, you're looking at both.
We basically make sure that every medication we pop, it has instructions here, and we have instructions here so that everything matches.
Compares, yeah.
So that we make sure that we're giving the right medication.
Exactly. And then also, he also would look at if it said PM, if it said noon, and then did that match the MAR. One other area, he compares his reconciliations to the physician orders to make sure everything, even a vitamin, right?
Right. Everything has to be listed on the physician's order, and also the doctor signs it to make sure that we always have the right medications here.
Yeah, because things change.
Yes, they change quite frequently.
So then at the end of the month, you have to go back and reconcile all those changes?
Every single medication, yeah.
Right.
And it has to be approved by the doctor.
Right, and so then that's resent to our pharmacy. So so he does use a centrally stored pharmacy, which means everything's, but however, some people can't afford that and they do need to use mail order. Right. And in that case, Jose trains the med techs on when to call the family, when they're running low.
Yes. We call them when we have at least a week medications left of that medication. So when we have 7 days left, we call them, we let them know, and we'll keep calling until they bring the medication, basically.
Yeah, because we don't want to miss dose. But I have to say, the reason I feel our program's so strong is his training, his shadowing. When he hires a new med tech, he watches her for him for a very long time to see, is it too fast? Are they getting it? And there's so much you have to look at, don't you? And he'll pop in to see how the new person's doing. I saw you do that the other day, and all of that's so critical. One other thing is they do test, and they pass an exam, and I think that really does help a lot. Doesn't weed out kind of people who don't understand and comprehend the details that are necessary to learn in this industry. It's pretty hard.
Yeah, and even if a med tech is not understanding, even though it's being trained and it needs more training, we'll pull them off the cart and then we'll give them the training they need, even if they need extra days.
And that's so critical because it's not a failure at all. It's just a lot to learn.
Yes, it's a lot.
It's a lot to learn. Well, I thank you for everything that you do for us and all of your management. I don't know what we do without you. Thank you. Thank you.
Jackie.